So first I'm going to do the GH flexion range of motion. My patient is supine, as you can see, and it happens in the sagittal plane. Compensation can be arched in the back for my patient, but right now it looks perfect. Axis will be the central humeral head, and my stationary arm would go along his lateral midline of his thorax, and my moving arm would go with the lateral epicondyle. And normal range is usually 180 degrees. So right now I'm going to get my patient to go ahead with thumb facing down. I'm going to get my goniometer and line it with the central humeral head and lateral medial line of the thorax. And my moving arm towards his lateral epicondyle. And my patient is at 170 degrees, which he's within normal. So next, we're going to do the GH abduction range of motion. I have my patient currently in supine. Some compensations would be my patient might elevate his shoulder or my arch his back, but right now everything looks good. The axis is going to be in the auxiliary, so in the armpit area. My station arm is going to be parallel to the midline and the thorax as well. My movement arm is going to go along his medial epicondyle, and normal range of motion is 180 degrees. So here we go. So I'm going to get my patient to bring his arm to the side and abduct. I'm going to get my stationary arm right along parallel to the midline of his thorax, and go right to the medial epicondyle. And my patient is 165 degrees, which he's within range. Next, I'm going to do the glenohumeral external rotation. I'm going to have my patient in supine position, which he already is. Some compensation to look out for is arch back, and he currently does not have that. Axis would be on the olecranon, so that's where my stationary arm is going to go, and then my movement arm is just going to follow the ulnar styloid process, and normal range is usually 90 degrees. So here we go. So I'm going to get my patient to go into a 90 degrees angle, a 90-90, and then I'm going to get my stationary arm facing up, facing towards the ceiling, and go ahead for me. And my movement arm is just going to follow the ulnar styloid process. And my patient is at 85 degrees, which is within normal. So next, we're going to do the glenohumeral internal rotation. I have my patient in supine position. A huge compensation to look out for is the head of the humerus popping out. It's going to go, the axis is going to be on the olecranon. My stationary arm is going to be facing towards the ceiling, and I'm going to have it lined up with the olecranon. And movement is just going to go follow his ulnar styloid process. And normal range is usually 70 degrees. So I'm going to get my patient in 90 degrees, and then I'm going to line him up. And then go ahead. So now you got to be careful because the ulnar head is starting to pop out. So let's do that again. So go in. Right. And my patient is at 70 degrees.